Okay, let's go ahead and get started. Welcome, everybody. My name is Stephen. Glad to be with you this afternoon. Welcome to this Prevention Community of Practice. The theme of our COP today is Data-Driven Strategic Planning, Part 2, Agile Tools for Enhancing Community Outcomes. So the COP is sponsored by the New Hampshire Department of Health and Human Services, along with growth partners, the New Hampshire Technical Assistance Centre. So before we get started and I hand over, I'd like to just take care of a couple of points of housekeeping with you. So firstly, we are recording today's event and we post these COPs on the NHTAC website. So to ensure a good, clear recording without interruptions, we'd like to ask you to keep your microphone muted unless later on you participate in a Q&A session. Also, if you're having any internet issues, you're struggling to hear, you can go ahead and maybe try turning off your camera, or you can access your speaker settings on the bottom left hand of your screen on the little arrow just next to the microphone. So we'd like to invite you to be as engaged as possible in this COP, so feel free to use the emoticons buttons that we have, maybe in reaction to something that one of our speakers says. And another thing we'd like to invite you to do is submit any questions that you might have. There'll be opportunities to answer your questions, and you can do that by entering your question into the chat. One thing we'd like to ask you to do, and out of respect for your privacy, is to avoid entering any sensitive information in there, anything that you wouldn't want posted on the internet. Fantastic. Well, with that, I'm going to go ahead and hand off to Kimberly.
Welcome, everybody. I am Kim Wade. I'm with the Bureau of Drug and Alcohol Services, the Prevention Services Unit. Me and Ann Crawford are here today to help support you as we go through this second part of this training for the community practice. This prevention community practice is here so that we can all share ideas, help troubleshoot challenges we have, and to learn new skills, and to also refresh some of the skills we already have. We want you to keep in mind that this is a framework, a strategy to use for our communities in addressing local conditions, and we use this as the backbone and the basis for a lot of the prevention work we do. So we're so thrilled that you're here to participate in the second part, and if you happen to miss the first part, I'm sure that that was recorded and posted as well, so you can watch that at a later date and really get a full feel for this strategic planning. I also want to remind folks that we have the New Hampshire tax system, where if you needed some technical assistance, you can actually submit it, and the Bureau of Drug and Alcohol Services will review it. And if we approve it, you'll actually be able to have growth partners help you with some of your strategic planning and data information and collection. So next slide. So when we had the October community of practice, we had some evaluation feedback to the question, how might you apply this content to your job? And we had a lot of great feedback from folks. So we're just going to review that. One of them was that it helps to remind there is a process to follow for a reason, and that's true. We use prevention science to inform our work. In thinking about how the youth I work with will factor into the new prevention efforts we implement. Again, that's also true because we look at our community and we get feedback from the various populations that we're working with and that we're trying to support. Working with regional public health networks and regions as they develop their strategic plan. Many of you know that are part of the regional public health network that we're going to have strategic plans coming up. And this is a great way to remind yourself of that process and how you're going to collect data and use it to inform your work. Completing logic models for my prevention coalition. Logic models are, again, another prevention tool that we use to help us keep on track. And then identifying problems, defining goals and objectives, identifying immediate, intermediate, and long-term outcomes through available data sources, always tying what we want for outcomes to a source and being able to measure those changes. Revising our community health improvement plan. As you know, most things are organic, and we make a plan and then we always review it and see where we need to change those plans to meet the current needs. Clearly defining short and long-term outcomes. And identifying and tackling goals from the YRBS, which many of us use when working with youth. Is that our last quote?
That's it. That's our last quote.
Well, these were great. And those of you that provided this feedback from the first training session, we really appreciate you letting us know how this training has helped you. And do not hesitate to reach out to the Bureau of Drug and Alcohol Services if we can be of any help as you do your strategic planning in your communities and regions. And then I'm turning it back to Lori, I believe.
Good afternoon, everyone. I'm Lori Barger-Sutter with the New Hampshire Technical Assistance Center. We are back by popular demand to, we had some feedback, as Kimberly was talking, that people wanted to see the end of the rest of the process. But because October seems like a long time ago, I'm sure to everybody, and because we have some new people, we're going to start with a short recap, and then pick up where we left off. So we're going to review the approach to planning. In your small groups, you're going to, if you need to, take a few minutes to review those that vaping case study that we used to do this planning exercise, and also kind of review where you were last time, which was from problem statements to outcomes. So let's go on to the next slide. Oh, there we go. So again, the big picture and the biggest picture in this planning framework, we always start with the problem that we're trying to solve. And when we're thinking about the problem, we're thinking about an adverse health outcome. And even more than that, we're trying to start where there's consensus, because to create change, you've got to have people on board with you. And so we're looking for that health problem that everybody agrees, or at least the majority of your partners would agree was a problem, and would agree that to work with you to solve it. So from that problem, then we're drilling down and we're saying, so what are the behaviors that are creating this problem? And sometimes behaviors are human behaviors, substance use itself, but sometimes there are organizational or institutional behaviors that are occurring. Should be social social determinants of health in terms of laws and policies, or the way things are enforced or not enforced, or the way certain institutions might behave, or organizations. And so from behaviors, then we're saying, okay, so what are those contributing factors that are allowing the behaviors to exist or promoting the behaviors? And we think of that as really the sweet spot of problem solving. When you can figure out what are the primary factors that are creating human, organizational, institutional behaviors that are undesirable and leading to health problems for people, when you can figure that out, then you're well positioned to know what are the best strategies to implement. But you'll notice in this framework that we work sequentially through. So we're really being community diagnosticians here. We're focusing on problems and behaviors and then contributing factors before we get to strategies. And some of you may use the words root causes, intervening variables, instead of contributing factors, which is fine. It's the same concept. Let's go to the next slide. So to implement that, we go through a series of steps of kind of drilling down, and we always start with data. Go ahead and there we go. And so we've got our case study today that is providing our packaged assessment for us. From there, we're going to go to creating a problem statement. And those of you that were with us last time were part of this, succinctly saying, stating what is the problem that exists and who is it impacting, so that you could communicate that to somebody easily. Next, okay. And when we do that, we always want to avoid the first pitfall of planning, which is falling into that lack trap. And we do that when we talk about something that doesn't exist, as opposed to the problem that does exist. the lag trap you rarely works, and it usually boxes you into a course of action that may not be very productive, rather than allowing you to continue on with that diagnosis, that community diagnosis process. Okay, next box. So from there, we're developing goals, which just means flipping that problem, turning that problem into what you want to see. Next box. And we're going to avoid the second pitfall there, which is the jumping to strategies. And that's the biggest challenge we see in planning processes, is that avoiding that human, very natural human temptation, or just, normal reaction to want to do things. But the problem is, when we do things before we have clearly diagnosed the issue, we may not do the right things, or we may do things that are not effective. And sometimes we can even make problems worse. So we're going to avoid jumping to strategies, and you'll know you're doing that if you hear yourself talking about what you're going to do, as opposed to the positive human outcome that you want to see. The next box is long-term outcomes. So we're going to take that goal and we're going to make it measurable. We're going to say how much change in the goal, by what time, and how are we going to measure it? It's a good test to make sure that our goal is actionable and achievable, and that we can measure it over time. Okay, next box. From there, we're going to develop objectives, and those are going to reflect those contributing factors, intervening variables, root causes, whatever you call it. So what are the primary factors that exist that we need to change? We're going to create goals that just flip those. And then next box, we're going to create intermediate outcomes that, again, do the same thing we did for the goals. We're going to make them measurable. We're going to say this much change in this contributing factor by this amount of time, and here's how we're going to measure it. Okay, next box. Next step. So to achieve that, what kind of knowledge, skills, and abilities do we need to create? And who do we need to generate them? Who do we need to create them with? And once we know that, once we know we've gone through that, and we've clearly outlined our long-term, intermediate, and immediate outcomes, we're ready to talk about strategies, which is the next box. And from strategies, we're going to go to we're going to start thinking about implementation. How are we going to implement them, and how are we going to evaluate them? And so that's about where we pick up today. Although I think in all of the groups, there's opportunities to go up and strengthen some of the problem statements, some of the goals, some of the objectives, but we'll continue on with our map. So implementing, one more click, Stephen, is focused on our strategies and actually carrying them out. We carry out those strategies. What we're going to be watching for is next click, them achieving our immediate outcomes. In our process, our immediate outcomes then are going to, when we achieve those, they're going to help us achieve our immediate outcomes. And then our immediate outcomes helping us achieve our long-term outcomes. So all logically linked, but we start with drilling down through data and information, and then getting to strategies implementation, and then monitoring them on the way up to make sure we're getting the results we expect. All right. So there's a case study for this. Those of you that were with us in October have probably remember this. You might need to review it. I think if people that were new registrants, you should have gotten a copy of the case study to review. If you didn't, or you didn't have time, that's okay. We've got copies embedded in the collaborative workspace that we're going to be using today. And so if you need a few minutes to review and discuss it, let your group scribes and facilitators know that. And our case study focuses on vaping, which many of you might recall. And so this is the planning template that we're using to capture all this information. And it's a way to really succinctly just lay your plan out, not a lot of words. And it's intended to be something that somebody can pick up. Well, that somebody can pick up and read it and know exactly what you're doing, what are the outcomes you're working to achieve, and how you're going to implement your process. So it's also it's an important internal tool. It helps you lay out everything and monitor and manage it. It puts, you know, what you're doing and your evaluation and your implementation all together. But again, as I said, it's an important communication tool for your community members and your partners. They should all be able to pick it up, to read it. It's compelling to them, it makes sense, and they see exactly how it's going to lay out. And so that's one of the things we'll be focusing on today, picking back up and strengthening where it's can be done, problem statements, goals, long-term outcomes, reviewing those things you did before, strengthening them, and then moving on and completing that process. All right, next slide. So we're going to be going into small groups. I think we're just a little bit early, and that's great. We're going to spend until I think 1:30 in our first small group. We're going to do introductions. If you need to review the case study, you can do that. And then we're going to ask you to review and refine your previous work. If you're new to us, we use a electronic whiteboard called Miro, and we've got a scribe and a facilitator in each of the groups. They're going to be taking notes and sharing their screen so you can see the board and the plan as it unfolds in time. We have tried to put everybody that was with us last time back into the same group and then disperse new participants among those groups. If you were here last time and you find yourself in a group that wasn't the group you were in, Stephen's got some tips on how to move yourself. So Stephen, I'll let you explain that, and then we will go into our small groups.
Yeah, great. Thanks, Laurie. Yeah, so it's pretty simple. Most of you should be in the right group, but say that you're not. At the bottom of your screen, you should see the 4 squares, and that is to open the functions of your breakout rooms. So if you find that you need to change to a different room, go ahead and click on that icon for breakout rooms, and then click on expand all, and that's going to let you see the 4 groups and who's in each group, and you should be able to recognize the names of those who you're with in the last one. Once you've identified which group you want to join, just go ahead and click on join, and that should automatically move you to the correct group. If you have any trouble with that, you can also come back to the main room and just let me know who you were with last time, and I can assign you to the correct group. So I hope that's clear. If not, please come back to me for any help you might need. So if you're ready, Laurie, I'll go ahead and launch this breakout.
I am, and I misspoke. We're going to be in small groups, not until 1:30, but until 1:50. So it's important to read those agendas correctly, isn't it, Stephen? So yes, we're ready.
Okay, I'll go ahead and launch them now.
All right, hello everyone. So what we can do first is introduce ourselves, and if we can include whether or not we were in the October meeting or not, so that we know who has a little familiarity, even if you don't remember all the work that was done, a little familiarity with this activity, and who is brand new to what we are doing today. Is there anyone who would like to introduce themselves first?
I can start.
Great.
Hello, everyone. My name is Sierra Hunter. I am the Substance Misuse and Suicide Prevention Manager at the Partnership for Public Health in the Winnipesaukee region. And I am new to this. I was not here back in October.
Hi, everyone. I'm so sorry. I had to hop on a phone call really quick, but I'm here now. My name is Sarah. I'm a substance use prevention specialist with Reality Check in Jaffrey.
Great. And were you here for the October group?
I believe I was.
Okay, great.
I can go next. Hi, everybody. I'm Andrea Smith. I am the Substance Misuse Prevention Coordinator for the Upper Valley Regional Public Health Network, and I co-facilitate All Together, which is our region's Substance Misuse and Suicide Prevention Coalition in the Upper Valley region. And I was here back in October for this.
Great.
Hi, I'm Vicki. I coordinate the Dover Coalition for Youth and Dover Youth to Youth. I was here in October, and I actually have to apologize. I have to hop off around 2 o'clock. So I'll be stepping out a little early.
Thank you.
And I'm Mana Rose, and I'll be your scribe today. I'll be assisting Maura.
And my name is Maura McGowan. I am the program director for the New Hampshire Teen Institute and part of the Community of Practice Planning Board, and I will be facilitating our time. I don't have screen share, Mana. Do you have access to? Oh, perfect. Okay. All right. So how would people like to review the case study? Does everyone have access to the case study and they'd like to read it on their own for a few minutes? Would we like to have someone read it out loud? What are people's feelings around the case study?
I don't think I have it in my email. I was just looking quick.
Likewise.
Do you all see my screen, or is it just my desktop?
It is small on my screen. I was going to.
But you all see the case study, is that correct? Okay.
Mm-hmm. Oh, now it's gone though. All right, let me. All right, so is someone feeling like they'd like to read the case study out to the group so that we can make sure everybody has access to it? No, I don't mind reading it if that's okay with everyone. Okay. All right, so our case study is Balsam County encompasses approximately 1,000 square miles, much of which consists of villages, small towns, and rural areas. The county also includes the city of Metropolis, however, which is located on the southern edge of Balsam County and has a year-round population of 40,000. Metropolis is also the site of Sizemore College, which has a student population of 20,000 during the fall and spring academic semesters and 3,000 during the summer months. The total resident county population, excluding the college student population, is 58,000. Conditions in Metropolis differ significantly from the rest of Balsam County. In Metropolis, the college plus prosperous business sector attract employees and residents who tend to have higher levels of academic achievement and income than residents in the rest of the county. Metropolis also houses a hospital and other health and human service agencies which serve the county and surrounding region. The population of Metropolis tends to be younger than that of the rest of the county. Those living outside of Metropolis represent a primarily older population. Most residents work in or are retired from jobs that involve physical labor, service industries, or skilled trades. Most residents have completed high school, but few have college degrees. Unemployment rates are low, but income levels are low as well. Many residents are socially isolated and tend to be reserved around newcomers, which includes staff from the health and human service agencies located in Metropolis. The problem: In 2020 to 2021, 5 students from Metropolis High School and 2 students from rural Balsam County High School were seen in local emergency departments due to health issues and injuries related to the use of electronic vaping devices. 2 visits due to lung injury from chronic vaping, 3 due to vaping substances other than nicotine, and 2 visits due to traumatic injuries from the device's malfunctioning. Behaviors that are contributing to the problem. Balsam County has seen significant increases in vaping among youth and young adults from 2017 to 2021. Prevalence data from the YRBS provided in the table below. The following general characteristics were observed of those who reported past 30-day vaping. Males and females were equally likely to report vaping at the college and high school levels. High school vaping increased with grade. Survey numbers were too small to distinguish students who had reported vaping by race, ethnicity, and other characteristics. All right, so that is our case study. And what we worked on for those who were here last month or 2 months ago, we started working on looking at what the problem statement was, what the goal was, what our long-term outcomes would be, long-term outcome indicators, objectives, intermediate outcomes, and intermediate outcome indicators. So that's the work that we started on. And can continue kind of talking through. Mona, can you put a link for everyone in the chat as to where our the Miro board itself, so that they can see a bigger copy of it?
And then once you click on this link, in the upper right-hand corner, you'll see a circle with my picture in it. If you click on that, it'll take you directly to the board. And do you all not see my screen with the Miro board on it?
I did before you stopped sharing, but it was really, really, really small.
Okay.
But I could see it.
Okay.
Same, I could see it, but I couldn't read it. Have people successfully made it to the Miro board and found where we're at?
And we're group 2.
Okay. So our problem statement we had come up with is emergency department visits related to 12 to 25-year-olds vaping in Balsam County. So the question they've posed for us to consider is, have we satisfied the question of who, what, when, where, and how? And if we haven't, what could we still add or make more clear?
I don't think we've necessarily determined a when, just with that problem statement.
Mm-hmm.
I feel like the who, the what, kind of the where, I think those are pretty clear, but I guess maybe the when and how. I don't know if
Yep.
emergency department visits constitute the how, but that's what I'm thinking.
Yeah, I definitely agree with you, Andrea. I think the adding in, I think it was what 2020 to 2021 emergency visits, emergency department visits during 2020 to
Yep.
2021 related to.
So adding during 2020 to 2021. And I think too, the maybe being more specific than just you know, from vaping, like that they had, I'm looking for the line now, health issues and injuries related to the use of. Does that feel like it covers more of a more specifics in the problem statement? Anything else anyone feels we should have in there? Okay. So then the next one is our goal, which is our desired change in the behavior that leads to these health consequences. So we had come up with past 30-day use of, I think that's vape products. So how could we make that maybe more specific? For example, reducing by percentage over a time frame. What are some thoughts on how we could make our goal a little more specific?
I think it's just adding in reducing, so sort of telling people that we want to see that go down as opposed to up, because past 30-day use of vape products is just kind of vague. So we just need a direction of change.
Maybe adding in 4 12 to 25-year-olds, be specific around that age group too.
And I think some of that would depend on what data sources we're using. Because if we're relying on the YRBS, you know, that's only until like high school students. So we wouldn't have that young adult data. So ideally it would be 12 to 25-year-olds, but that may not be measurable.
Any other changes to our goals? So then our long-term outcome is looking at our goal by degree of change by a date as documented by a data source. So we originally had decreased past 30-day use of vape products by 10% by 2025 as documented by the YRBS.
I think just adding in that by high school students or some age range that's captured within the data we're referencing.
Yep.
So my only concern here is that we're saying 12 to 25-year-olds, but the YRBS doesn't capture all 12 to 25-year-olds. It's just a small segment of that. And I get that it's the reality of the data sources and stuff that we have here.
Do we revise that age range to high school students?
I think that would be more reflective of the YRBS or even middle and high school students. So the problem statement, that's the data that we have, is the ER visits are 12 to 25-year-olds.
Right.
It's just hard because the data sources don't line up.
Right.
So middle and high school students in Balsam County?
I think that's a little more measurable.
Yeah. Does everyone agree with that?
Yes, I think that makes sense.
I had a question on, so since there's the college town, what kind of data is collected? Could we use, data source could we use for college students? That exists, is there? We could do as documented by YRBS and another data source.
Yeah, I just don't know what that data source would be.
Okay.
Right.
We could make up some fictional.
I mean, I think.
Yeah, I don't know if there's any specific.
Yeah, I think in New Hampshire they do a young adult like survey, but I'm not aware of what the exact questions are. And either way, it's probably not going to be asked in the same way as the YRBS questions are asked. So
Yeah, the only other place we could probably see a change is by going back to the hospital data, because the 12 to 25-year-olds came from the hospital data. So comparing the hospital data again would give us that same accounting.
So is that something you want to include so that we can change it back to 12 to 25-year-olds? As a data source.
I think we do 12 to 25-year-olds and then just add in whatever college survey. So it looks like there's a national survey of college behavior. I'm just not familiar with it because it's not something that we utilize.
But we could
like
more
a college version of the YRBS.
Do you want to add ED data, as Maura mentioned?
The only hesitancy I have with that is that the ED data is kind of skipping that goal. because our goal was to reduce the 30-day use of vape products, and hope that it translates to the problem statement. But it's an option.
Yeah, I would agree. I don't know that the emergency department data fits in with 30-day use.
Okay, we'll go back. Just throwing things out there.
I think one thing that the case study does give us is that males and females were equally likely to report vaping at college and high school levels. So there must be some college data somewhere. It just doesn't tell us kind of what that source was.
I say we just make up whatever the college survey is called, and it's just a case study anyway, so.
Yeah.
And I think a lot of this is us just being nitpicky to make sure everything lines up and makes sense building off of each other.
Mm. All right, so in the next section, we're looking at outcome indicators. So looking at our long-term outcome and then adding in any intermediate indicators we may see.
Maybe we move on from this one and get down into, I mean, unless anybody has any ideas, what would that look like? unfortunately, we haven't gotten to even the meat of what we need to, right, Maura? Oops. Should we move on to objective and maybe we'll come back and see what others share?
Yeah, I think that makes sense. And we, I believe we'll be coming back to this anyway in our
Okay.
next breakout, so we have time to do more.
Okay.
Do more work on all of it. So our objective was decreased access to vape products to youth. So one of the notes was to include more detail, like retail access. Any thoughts on further details we could add?
We could change the age range so that it matches our others.
Mm-hmm. Be specific with the group that we've indicated, 12 to 25-year-olds.
All right, well, welcome back, everybody. We had I'm curious to hear at the end how everybody's groups are going. We had a very real life situation in our group where our coalition completely turned over, and we have all new coalition members who are looking at a strategic plan that was started by somebody else and making it make sense to them. So and like I said, I'd be curious to hear how everybody's groups are going. So we're going to carry on, and we're going to do one more bit of review, and then we're going to introduce a new concept related to creating and managing change that we use a lot in our work. It's called the right or the elephant in the path. We're going to talk about strategies and activities and implementation and evaluation, and then put you back into your small groups to continue on from where you left off when Stephen picked you up and carried you back to the main group. So let's go on to the next slide. One of the concepts we talked about in part one of this was the Pareto principle. And it's something that it's a really important principle for those of us who are working to create and manage change. And it's existed for a long time, and sometimes that's called the 80-20 rule, and it's not always 80-20, sometimes it's 70-30 or 90-10. But the heart of it is that in any group of things that contribute to a common effect, a few contributors, out of all the contributing factors, there are just a few that are going to account for most of the effect. So, for example, if you have a problem and you have lots and lots of contributing factors to the problem, the likelihood is that there are just a few of those factors that create 80% of that problem, or or maybe 75% or 90%. And likewise, it also works in reverse. So about 20% on average, 20% of the things you do result in 80% of the results that you achieve. And so the key to creating and managing change quickly is to identify those things, those factors that have the biggest impact on the problem, and directly addressing them, and also realizing, really focusing your efforts so that those things you are doing, you're doing more of the things that create bigger results. So let's move on to the next slide, and we'll take a look at the Pareto principle in practice. And this is a slide that was created in Excel. When you take data and you go into Excel to make slides, you can choose pie charts and bar charts and graphs, but you can also ask Excel to create a Pareto chart for you, which shows you kind of that trend line. So this is from the National Survey on Drug Use and Health. It's a little dated right now. It's from 2016, but it's national data, and it asks people, of those people who misuse pain relievers at ages 12 and older. It asked them, if you misused pain relievers, where did you get them? And here you can see the Pareto principle in action. It's a little small, but on the left-hand side, you can see most people, about 40% said from a friend or a relative for free. And about 35% of people said a prescription from one doctor. So in the Pareto principle world, these would be the vital few. And everything to the right of that would be sometimes what's called the more trivial many. And so if you really wanted to drive down misuse of prescription pain relievers, and you were focused on access, you'd want to focus on those people who reported, you'd want to focus on social sources, friends or relatives, or prescription from one doctor. If you're focusing on doctor shopping, say, which is that one, it's the second from the right, prescription from more than one doctor, you're not going to get as big of effect for your efforts. So that's the Pareto principle in essence, and that's why we talk about those contributing factors being the sweet spot of problem solving. When you can find those ones that have the biggest impact and you address them directly, you can see significant change relatively quickly, and that's been our experience. So next slide, Stephen. So on to the rider, the elephant, and the path. This is one of our favorite frameworks for thinking about how to create and manage change. It was developed by an American psychologist, Jonathan Haidt, and he wrote about it in his book, The Happiness Hypothesis. And it's a way to visualize or think about change by breaking it into 3 pieces. Let's go on to the next slide, Stephen. So the rider, you see sitting on top of that elephant, he symbolizes our rational brain. And go ahead to the next. And the elephant symbolizes our emotional brain. We both have rational parts in our brain, and we have emotional parts, and we have them in different mixtures. And I'm sure you see that in the people that you work with, and your family and your friends, that some people are very analytical and some people are driven more by emotion. But it's important to understand that we all have both, and that the people that we work with have elements, have differing elements of that. And then finally, the third element is the path, and that represents the way forward. So things to know. The writer provides the direction for the change. He's logical. He loves to make plans. He loves to look at data. He likes to focus on problems. But the writer can be indecisive. Sometimes he has a hard time making a decision because he wants to look at more and more and more data. And he can be frustrated by uncertainty. The elephant, that emotional side of us, doesn't really care about data. Likes gratification, likes to see action take place, likes pleasure, wants to avoid pain at all costs, often needs reassurance, can get overwhelmed quickly. But the elephant provides the passion and the power and the drive for the journey. Without the elephant, the rider's nowhere. And while it might look like the rider's in charge, he's sitting up on top and he seems like he's directing, anytime there's going to be a disagreement between the rider and the elephant, or if the elephant gets spooked, the rider's going to lose every time. The elephant's going to thunder off and things are just going to come to a standstill. So it's really important to bring all 3 of those pieces into harmony. And we'll go ahead and go on to the next slide. So, and this is one of those you have to click there. So when you're planning change, you need to think about, is it going to feel safe? Is it going to make sense to the rider? And is it going to feel safe to the elephant? So you can push ahead on a direction, but if the emotional parts of us are uncomfortable with it, it's probably going to get stymied. It's not going to go anywhere, and it might even go backwards on you. And so, make sense to the rider. it's supported by data. It feels safe to the elephant. It feels doable. And then the path has to be really clear to both. And that's where your strategic plan or your work plan or your action plan really comes into place in terms of being very concrete and very clear. Everybody knows what they're setting out to do. All right. And so in your plan, you want to motivate that elephant to move forward. You need to direct that rider. You need to give him the information and the data he needs to make good decisions and help him make those decisions. And then in your plan, you are shaping the path. All right, next slide. So I think people are probably still working through their problem statements, their goals, their long-term outcomes, objectives, immediate outcomes. Those are things that we focused on in part one. One of the things we're going to try to get to in part two, you work at your pace, and we know there's lots of new people, and so you may not get through the whole process, but some new elements you may start looking at include long-term indicators, long-term outcome indicators, intermediate outcome indicators. That's not always applicable, but it might be. And those are just things that break the change down. If you're looking for a degree of change by, say, 2027, you don't want to wait until 2027 to find out if it happened. So you might break it down into indicators, 2023, 2025, here's where we want to be. So usually you're going to have those indicators for your long-term outcomes so that you're monitoring as time goes on, and you may or may not for your intermediate outcome indicators. Some of you already have identified immediate outcomes. Some of you might be changing your immediate outcomes. Some of you need to identify your immediate outcomes. And then from there, we're going to go to strategies, activities, really make it actionable and implementable. Not too worried in this session about timelines or people are responsible. But we do want you to spend some time, if you can, talking about process indicators. How are you going to know that things are getting implemented the way that you intended, and then outputs. And I'll talk a little bit more about those constructs before we break into small groups. So let's go on to the next slide. Let's see. So strategies, when we're talking about strategies, we're saying a broad course of action that you need to undertake. So that might be conducting a communication campaign, training retailers, inspecting retailers. And then the activities are like, okay, so what are the actions that we need to take to do that? We might need to create an accurate list of retailers. We might need to develop a training curriculum. We might need to develop merchant education materials. It's just really helping you think through all the things that need to happen. Next. All right, process indicator. We're going to ask you to think about, so what are you going to monitor over time to make sure all those activities are happening? So it might be, if you're going to do trainings, it might be the number of trainings that you've completed by a certain point of time, might be the number, you might be monitoring the number of people that you've trained, out of all the people that you have to train. It might be, if you're doing retail inspections, it might be how many of you completed by a given time. And then finally, I think outputs, yes. So what are you either going to have to create, or what will logically be created as a result of your activities? So you might need to create a curriculum. You might need to create an inspection protocol. If you do trainings, you're going to have lists that get created of all those people that have been trained, and inspection results are another type of output that's going to produce more information and more data for you that you can use to monitor. So next slide. So we're going to go back into small group time. This slide, it picks up, you may not be at immediate outcomes. You may still be working through your strategic plan, particularly if you're in a group like mine, where the coalition members have turned over and we've got brand new people who are reviewing and vetting. But at this point, we're going to go back into small groups, and we're going to be in small groups, I believe, until 2:35. So we'll have about 30 minutes.
All right. Looks like we may have lost a couple of people.
Can you,
But that's okay.
can you all see my screen?
Yes. Thank you. Sorry, I have some, there's some work going on in the building, so I hope you can't hear that. But if you hear any weird sounds coming from my Zoom, that's what we're dealing with right now. So, all right, I'm having trouble with my screen. Just one moment. There we go. Okay. All right, so we started to look at the objective before we went back to the large group. So I just want to make sure we were able to get all our thoughts out on the objective. So desired general, our desired general change in a priority contributing factor. So we have decreased retail access to vape products, 12 to 25-year-olds in Balsam County. Is there anything, any thoughts around that that we weren't able to cover before we went back to the large group?
We could add in by 2025, if this one needs like a.
Yeah, reiterate that that goal, that goal date. All right, so then we have our intermediate outcome. And we have there decrease access to vape products by 5% by 2023 as documented by the YRBS data and retail violation rates. And decrease hospital emergency department visits by 5% by 2023 as documented by hospital ED data.
Does that work for adding college data? Because we use that as.
Yeah, I mean, I think if our idea was that we're sort of making it up ourselves and we can just pretend like we get that from college data, I think that's fine.
Okay. So our intermediate outcome is to decrease the access to vape products and decrease the hospital visits. Our long-term outcome indicator is to decrease past 30-day use by 10%. for that age range by 2025. So in looking at some of our intermediate indicators, what are some of the things that we could be doing that could work to help us reach the goal of our intermediate outcomes and then our longer term outcomes?
So is this Maura, where we're looking at the, let me just scroll a little bit, these two things that are already filled in? I can't remember if we chose these down here, the increased knowledge of retailers and then the increased knowledge of parents. And yeah, I think we did. We decided those last time, I'm pretty sure. So is that what you're
Okay.
asking? Are we looking at these two things now and then deciding the strategies, or am I jumping ahead? Can you just clarify that?
Yes.
Please.
So that is a good question. So yes, I think in this long-term outcome indicator box that we kind of went ahead to objectives and intermediate outcomes was where we were going to come back to what are those intermediate indicators that are going to help us reach those long-term outcomes. So those could be some of them, and then we'll get to the strategy and the activities. But these could be those things that we're working on to get us to our long-term outcome, if that makes sense.
Would one be use of evidence-based practices to reduce youth retail access? I don't know.
Yeah, there are programs, right, that you can engage in, like campaigns for retailers that can help to educate them around being good retailers, right?
Yeah, that's kind of the line I was thinking about. What do you all think?
I think I'm still a little confused. So I think that would work as something that helps us, but how would you measure, would you say like the number of people that participated in one of the evidence-based programs? Like, would you have a goal as like reach 50 retailers or something like that?
That would be my guess, is that based on the number of retailers in the county, have a goal as to how many of them are educated and maybe sign on to and are then checked in on, which I'm sure is all part of like a prevention. I've never done like vaping specific like retail prevention stuff, but I would guess there's similar things to like when they did the ones around cigarettes and informing retailers around alcohol and things like that. So something similar.
Yeah, but you're right though, Sierra. I think that doesn't measure the decreased use of vape products, right? I see where you're getting at.
Yeah, I was trying to figure out where it lined up.
Yeah, sorry.
No, you're good. I think that one thing that you could say is that like if you're decreasing access, you might be, or hopefully, right? You're also decreasing use.
Mhm.
So I think we could put that one in there as, but another one that might work is kind of that retail violation rate, like maybe decreasing. I don't know, the number of retail violations within the year.
Yeah, in our intermediate outcome, we have decreased access to vape products by 5% by 2023. Yeah, so maybe the intermediate indicators, the decreasing retailer violation rate through what do we have it through like a vaping education program for retailers or something like that. Yeah, so if you're in the Miro board, if you go 2 pages over to the right, we have some data on, which is where I think we got some of those outcomes, ideas for outcomes in looking at the data. So access to vape products, and then the sales of vape products to underage people, and then some other anecdotal information around other possible variables, like parents and teachers unaware of the multiple forms of electronic vape products that are available, not full, being not fully aware. So I think that's where a lot of that information or decisions came from, was from this information here. Do you all see that? That's the small group breakout 2 from last time. I think that helps a little bit in why we put together what we put together. And in looking at the access to vape products, I noticed that it's opposite, almost in, not opposite, but different, like where those who are at Metropolis High School are getting their vape products versus where the other Balsam High School high schools are. So doing a retail focus will help a lot with Metropolis, but for the other Balsam High schools, a lot more work around online, social settings, things like that would be important, because it's a significant difference in store access for the two areas. And some of that retail stuff might bleed in, like if kids in Metropolis High School are getting them at the store and then socially giving them to kids at the other high schools, that may be playing a part, but not just at stores that they're getting them.
So I think I need to have us go a couple steps back for just a minute to help me just clarify. So when we look at the long-term outcome, I get what that is, but when we specifically say long-term outcome indicators, so to clarify, those are things that we can sort of check in on to make sure that we are kind of on our way. So it's not necessarily strategies, it's like, what can we measure that will show us that we are on our way to reaching that? And then, so that would be the same for the intermediate. So it's like even more broken down, like even more short term. What things can we kind of measure to show us that we're already on our way? Is that right?
I believe so. I looked it up just to get like a definition. And what I found was that the outcome indicators are specific, observable, and measurable accomplishments or changes that show the progress made toward achieving a specific output or outcome in a logic model or work plan. And those can include things like participation rates, attitudes, individual behaviors, incidences, and prevalence. So yes, I would agree with how you phrased it.
Okay, that's helpful, because I think I was just stuck on like, if we're getting this through YRBS data and YRBS data only comes out every 2 years, how are we getting any other data? So that helps for me to think more broadly. So thank you for that clarification.
Happy to.
And I think in kind of those long-term outcome, we could use that we could add in, well, I'm trying to figure out where to place it, whether it's an intermediate outcome indicator or if it's a long-term outcome indicator.
It is hard to know, right?
Yeah. I almost feel like the intermediate outcomes are almost those long-term indicators, and then they're further broken down. But so I'm going to say an idea, and you guys can tell me where it might best be placed. But we could do like the percentage of schools that implement like a vaping education program or do a module within their health class. To kind of get more of that attitude that vaping might be dangerous, and then hopefully address some of those social aspects.
Yeah.
Can that go under both? Like, could the intermediate outcome be like, I don't know how many schools, I don't know if it says how many schools, but like the intermediate outcome indicator be like, have, I don't know, 25% of the schools implement that, and then the longer term would be actually how many schools for the whole time? Like, can you have duplicate and just kind of change like your numbers or percentages?
Yeah, I believe you can. So since that's 10% and we have 5%, I think we could do that, right, Maura?
Yeah, I think so. I didn't see how many schools there are anywhere specifically. I could be missing it, but I don't see an indication of schools. And I think some kind of like general campaign around like vaping for the community would be really good, since it looks like everybody in the community is unaware of the hazards of vaping from what the anecdotal evidence is saying. Students, parents, community members not fully aware of the harms, and there's been limited merchant education for clerks. So, you know, the retail work will be important, but if they're also like seeing the same education as a community member, and then on top of that, their merchant education programs, that'll probably be more effective.
You'll agree with what I've put down so far?
Yeah, I think that
Yeah.
sounds good.
I think, would it be decreased retailer violation rate and like increased community-wide education and increased merchant education?
Yeah.
But the rest of it is cool, what we talked about.
Sorry. It's a little hard to navigate sometimes.
Yes, I very much appreciate Mana being the scribe, because I find scribing on Miro in a group very stressful.
Yes, you're doing a great job. I've done that role before, and it is difficult to do.
Thank you. So do you think we're ready to move on to the next, the immediate outcome? Did I put this in the wrong section? No, sorry. Okay.
So we're moving down to our immediate outcomes, the grid, right?
Yeah.
Okay. So one we came up with last time was increased knowledge of retailers around their role in best practices in reducing vaping product sales 2023.
Are we listing kind of a strategy or activities now? Yeah. So I think the strategy could be like an educational or awareness program, and then the activities would be like the specific like evidence-based program that we chose, and kind of where it was going to be, things like that.
Did you, educational awareness program?
Yeah.
And then, I'm sorry, activity?
So we could do like I guess, like a series, essentially, like a 4-session, kind of tailor each one toward a specific sector of retailers. I don't know the names of any evidence-based ones off the top of my head, but
Sorry, guys. I don't know what's going on here. Okay.
Well, it really is a tiny
I'm
font
trying.
that thing put in place. Wow.
I don't know. I'm trying.
That's all right.
Okay. So 4-session awareness program.
yeah. Another activity we could hang like flyers or give like the little I forget what they're called. They're like the stand-up things that you can put in front of like the cash registers. Maybe with some rules or regulations.
Would that be part of the program or would that be the detailed?
I think either or. I think it could be its own thing.
Be a separate activity. Yeah, like delivering materials to be posted at stores to retail establishments could be its own activity.
Would doing like the retailer checks, I can't think of the actual like term for it, would that even fall under this immediate outcome, or would it have to be its own separate thing, since it wouldn't, because I could see it kind of falling under increasing knowledge in terms of like we could take, you know, retailers that failed this you know, I don't know if it's not necessarily an inspection, and provide additional, you know, training and information to them. But I don't know if that is enough, or if it should be its own sort of category.
I think it would work under this one, because I think that if you did like that general awareness series that anyone could go to, then you went around and you did the checks. And then for those that failed, you delivered the materials. That might kind of work well as some activities that work together, kind of all to achieve this one goal.
Would they be the informal or the sign-R? Would we just go to the, you know, I believe that's the sign-R, right? Retailer checks, or is that inspections?
Yeah, that's kind of what I had in mind. But I know they don't do every single retailer, so it really, I think, would have to be a partnership with like DLE and our local law enforcement and coalitions. But that is what I had in mind.
All right, maybe what did we say, by 2025 this would all be done? So should we, when are we starting?
So we wanted some of these things to be 2023, like the more intermediate outcomes in 2023 and the longer term outcomes in 2025. So
I guess we could come back to this, but we should do the who's responsible process indicators and outputs. That's more. So who's
Welcome back, everybody. That was, I don't know about your groups, we'll find out soon, but that was a quick 30 minutes for my group, which was as I said before, was a new coalition taking over an existing started plan. So I'm going to share my screen. Let me step back. We're going to take some time to have each of the groups present. And we'd like to have the scribes share their screen and the facilitators, or if they have chosen someone else, and then present what happened in the groups. What did you struggle with? What were your successes? How might you do this process in real life? What would be the challenges? Did you talk about the elephants and the riders in your coalition or your community, and how, did you have time to do that, to talk about what would be palatable to the elephant, what would make sense to the rider? So I'm gonna start first with group one. I'm going to share my screen, and then I'm going to ask Kimberly to take us through and just provide us with a recap of group one. And can you see my screen okay? You see that template?
Yes.
Okay. So you just tell me where to move to, Kimberly.
Okay. So much to the realities of the work we do, we create partnerships and collaborations, and sometimes you have people switch roles and you have new partners. So we had a brand new coalition working off of a plan that was started by a different coalition that was in existence in October. And so we, as you can see in ours, Lori was kind enough to change the colors. So all that purpley blue is what the new coalition worked on. And anything that's still in black is what the previous coalition had put into place. And the things highlighted in yellow are going to be the priorities that we're focused on. So we had a really robust group of folks at varying degrees of familiarity with the prevention work that we're working on today. So we came up with looking at the vaping is causing the injuries to high school students, resulting in them going to the emergency department. And having seen that sharp increase, we hadn't landed on one that we liked the most, so we kept them both. Then we worked on to the goals. Originally, the goal, I think, was in the previous coalition was to educate youth. This new coalition has different relationships in the community, so we've decided that we're going to try to work with our retailers to educate them on underage sales to youth, as well as understanding tobacco 21, because that was recently passed in our case study, and reducing social access as well. So having those folks that may be unaware of the harms of giving vape products to youth, informing them of that. So then we had to basically revamp some of our long-term outcomes and objectives. And please, anybody, if you feel I am missmoking or missing something, jump in like a real coalition would. So our primary goal was to reduce retail sales of vape products to underage person. We decided let's look at retailers and perhaps educate them. Maybe they're unaware that there's penalties involved in selling to underage youth. Maybe they're not informed of Tobacco 21, so they don't think that they're breaking the law by selling to people that are 18 and older. Do they fully understand the harms of vaping on youth? So we chose for a long-term outcome to reduce retail sales of vape products to underage persons by 50% by 2028. Oh, and I can't see the rest of that, Lori. There you go. It's measured by the RVR rates and the YRBS data, because we wanted to use two sources of data to confirm the progress we were making. And then we used for our long-term outcome indicator to reduce retail sales of vape products to underage person. We hadn't determined by how much or by what date and how we were going to measure that. And as you can see, we have the black, which is from our previous coalition. So the objectives, we decided to increase retailer perception of penalties faced by selling vapes to persons under the age of 21. Again, it could just be a unawareness of the new law for 21. It could be not being aware of penalties. We also want to decrease the density of vape shops throughout the county, because the other thought was if there's no ordinance set up, they may be situated near youth. So having that limitation would mean also limiting the access that youth might have to those retailers. And then we went into intermediate outcomes where we decided to increase retail perception of penalties faced by selling vape products to youth. And we were going to measure that with pre and post tests from trainings of retailers, and as well as the number of retailers who are trained. We wanted to do that by 50% by 2025. And also limiting the density of the vape shops throughout the county. Again, we hadn't had the opportunity to set the time for by what percentage and by what year, but we did think that a good measure was to see how many licenses had been issued, as well as the ordinance passed, because as we had seen in the case study, there was fairly little vape shops, and then there was some growth in that. So we anticipate while we're working on this, that there will continue to be a growth of vape shops present in the county. And I think that's as far as we got. Does anybody else have anything they want to add from my group that I might have missed or overlooked as I recapped? I don't want anybody to feel like they're not properly represented in our coalition. I take silence as acceptance. So that was our group. It was really great. We had a lot of great conversation, and I think we really, it was interesting, and I really relished the fact that we looked at this problem from one perspective, and then when we had a whole new coalition, even though they were looking at the same problem and they were going to come to the same results, the path that we chose and the outcomes we chose changed based upon how they wanted to tackle it. So that was a really wonderful experience. I like that. Thank you, guys.
Yep. Good job, Kimberly. So let's go to group 2. And group 2 is, that is Mana sharing her screen.
Laura, do you want to
Yep,
report
I'm
out?
here. Sure. So we had a mix of participants in our first small group of those who had been here in October and some new people. So we did do a review and updated our problem statement, goal, and long-term outcomes in that first breakout. So our problem statement, emergency department visits during 2020 and 2021 for 12 to 25-year-olds were experiencing health issues and injuries related to the use of vaping products in Balsam County. So that's what we were focused on. We wanted to reduce the 30-day use of vape products for 12 to 25-year-olds in Balsam County. And I thought we had put a date in there, but I think we were thinking by 2025 for the outside goal. And we talked about our long-term outcome, decreasing past 30-day use of vape products by 12 to 25-year-olds by 10% by 2025, as documented by the YRBF and a college survey we were hoping to have access to, since college students were also involved in the initial numbers of people that we would have access to or be able to do some kind of surveying of college students in the area. When we came back to our group, we did lose some of our team. So we were a little bit more, we had less people giving input in that second group that we worked on, but we came up with a lot of different indicators that we would like to see. So decreased retailer violation rates. We wanted to see the percentage of schools that implement vaping education modules increased. We wanted to increase the community-wide education on hazards of vaping and increase merchant education programs around vaping, so that we were really focusing on that educational piece and making sure that the people in the community were aware of what was going on with vaping, how vaping impacted them, how that vaping impacted the community, and the responsibility that retailers had to make sure that those who are underage and those who are younger weren't getting access to vaping. So we went through those, and then we started to work on our immediate outcomes. We didn't get as far into that. We got through our increased knowledge for retailers around the role of best practices in reducing vaping product sales in 2023. That was something we came up with in our first meeting back in October, and we did feel that was important to keep. So doing retail education awareness programs, so offering a 4-session awareness program, doing retail checks, and delivering materials to be posted at retail establishments. That would be helpful to increase that community and retailer education piece.
All right, great. Thank you, Maura. Let's go to group 3, which is Jeff and Monica. I'll have you share your screen, Jeff. Thank you.
Monica, just let me know if I need to move or when I need to move it.
Okay. So we went back and revised our problem statement just to be more specific. So we revised it to read: high school youth in Balsam County are experiencing injuries through emergency department visits and health consequences from vaping of nicotine and other substances during the period of 2020 to 2021. Our goal is to reduce the percentage of youth vaping nicotine and other substances in the Balsam County within the past 30 days. Our long-term outcome is to reduce past 30-day use by high school youth within the county from 49% to 34%, as determined by the 2027 YRBS data. And then we added reduce the emergency department visits from 7 to 3 by 2027 using emergency department reporting data. And if you could move it up, Jeff. So our indicators would be reducing the past 30-day use by high school youth as determined from 49 to 41% as determined by 2025 YRBS data. And then a long term, or actually a longer term, would be to reduce the use within the county from 41 to 34% as determined by 2027 data. Our objective would be to reduce the accessibility of vape products in the retail and social environments within the county. Then our intermediate objective is to reduce the retail access of vape products by high school youth within the Balsam County from 51% to 31% as determined by the 2025 YRBS data, and also to restrict or reduce the number of vape shops within the county. And then we got to our immediate outcomes and strategies. We did a little bit here. We wanted to change the perception of harm of youth or vaping products to the youth. By the strategy would be to provide education to the youth on the harmful effects of vaping. And we didn't get too specific on how that would be, whether it would be in health class or where it would be. But we would also develop and implement a media campaign providing facts and of harms associated with vaping. And then we got to responsible retailer training on the laws associated with vape products, providing merchant education to the retailers, develop a training or and coordinate a training for the retailers. I think that was as far as we got. We spent quite a bit of time on the measurable, like the SMART objectives. So thinking where we were going from to, so, and thinking about the data points that we had available to us. So that's where we spent a lot of time back up on the top pieces, but it was good. I mean, the process, I guess, is where we're really trying to refine.
Excellent.
Thank you.
Great job, group 3. So let's wrap up with group 4. We've got scribe Elliot and facilitator Ann.
Okay. I almost want to put this onto my team because I really just wanted to facilitate their thoughts. But I know we don't have a great deal of time left here, but I think that we had some old and new, mostly new, and several people in it were very new to this process in general. So we went back and forth from what we had started with in our original group to changing our problem statements and our goals. And then we continued to go back and forth and then head down the page and then come back several times. So our group,
like real life, Ann.
It is. It was crazy. And that's what we kept saying. And I was like, this is exactly what, you know, it is what happens. And unfortunately, Elliot has had some auto issues, so he was not able to put in too much. But he said the same thing, that, you know, you're going to go back and then go back and say whether or not you can do something. So the two things that seemed to be what would catch the group the most was when it came to our problem statement and our goal. So overall, did we want our problem statement to say something about specifically and our goal in regards to injuries from vaping, or do we want to go just say straight out, like, decrease the amount of vaping that is happening between the youth and the young adults? So all of the strategies, all of the objectives, all of the immediate outcomes, activities, everything was all the same, and everybody agreed to that. It was just drilling down on the words and the wording in the problem statement and the goal. So if we said just, you know, reducing the amount of injuries from vape devices. Like we hear of lack of education awareness around risk of vape devices have led to health concerns, lung related injuries. So is it to reduce vaping among, and this looks like Elliot went ahead and put in some of the stuff that we had decided at the very end, which was that by reducing vaping among youth and young adults, would it then in turn reduce hopefully the amount of injuries and health concerns that we're seeing in the ER? So we put down some of the reducing. Cora was really good. She went through and looked at some of the long-term outcomes, which is to decrease the sales of vaping, increase the perception of harm for vaping among high school youth, reduce past 30-day vaping rates by 5% by 2025, as measured by the 2019 YRBS data, because that's all we currently have at this time to be able to use. So the objective was to increase compliance among vape products retailers, because it showed that half of the high school students are purchasing vapes from the nearby shops, increasing perception of harm among students, parents, and community members, and decrease underage sales. Intermediate outcomes were to decrease the RVR among vape product, which is the retail violation rate, among vape product retailers by 10% points for the entire county as measured. And then if you want to scroll down, Elliot. So then we had done some of the intermediate outcomes, which was to increase the knowledge of tobacco retail laws among retailers and employers, the strategy and some of the activities. We also talked about the increased knowledge about vaping among students and caregivers. There was so much knowledge in this group, and everybody was so focused that they would, everybody's kind of second guessing themselves, I should say, and then thinking, well, maybe we shouldn't do it that way. So, I mean, you guys can jump in, please feel free, those that were in it, but I think that the whole difference between whether is we're going to focus just saying we're going to reduce the vaping amongst youth and high school or in young adults, or if we were going to try to decrease the lung related risks and injuries due to the vape product, seem to be the two things that everybody just kept trying to figure out how to say it, I guess.
Yeah, and I'm also concerned because I kind of helped. First of all, this was my introduction to this case study, so I kind of had to fast forward a lot of the stuff that usually takes me a lot of time to investigate. So part of me is questioning the problem statement. It might fall into that lack trap because it starts with the statement lack of education and awareness. So I don't know if that is what we're looking for in a problem statement, but we did, discuss creating a problem statement that incited action. But there's also a bunch of other things that I wish we could dove into as far as the rest of the process goes. There's decreased funding. So some advocacy I'd like to have included in here for funding. There's been no prevention efforts at the college level. And if there is an increase in social access, one could possibly be led to believe that it's because college level students are buying those products and sharing them with underage people. So increased college education specifically. And then also there are statements in there that state that the marketing is geared towards youth and young adults. So specific advocacy around, appropriate marketing strategies for these vendors beyond education of, underage sales. I think that marketing piece also should be included within these strategies. And that's all I have to say. I never know how to finish my statements. There you go.
No, it was great. It's like I said, they had so many different ideas and strategies and activities and outcomes and things they know they wanted to work on to ultimately solve the issue. It was just what was the direct statement. And I'm the one at one point that had said, now remember, don't focus on what we don't have and what we're not doing. by falling into the lack trap, and that's when Cora said, oh, great, that's what our problem statement starts with. So a great amount of work in this group.
Yeah, thank you so much. I want to thank all of the Balsam County returning planners and coalition members, as well as the new ones. Sounds like there was a lot of real life examples here. And of course, the biggest non-real life is you would never try to do planning in 50 minutes. So we appreciate all of the efforts and a lot of great following the data. I saw a lot of deep thinking and following the data, but we are out of time. So I'm going to turn it over to Stephen to just close us out and ask you for your all important evaluation feedback. So Stephen.
Okay, thank you so much, Laurie. Thank you for a wonderful presentation. Thank you to all of you, our scribes, our facilitators, and all of you for joining in. So just before we finish, we'd love to direct your attention to our website, nhtac.org, where you can see recordings of past COPs. You can sign up for future COPs. We'd love to have you involved as much as possible. And just finally, before we finish up, I'd like to share the evaluation link with you here in the chat. As you saw from the start of the COP, we really do value your feedback and we use it to shape future COPs. So please go ahead and share your thoughts with us as honestly as you can. And that's going to help us to keep making these events useful for you. So once again, thank you to all of you for joining us. And we hope to see you at a future Community of Practice. And have a great afternoon.